Ken Dash out here at Q104.3, and I'm here with a guy who, to me, is a true hero. That's Dr. Joseph Puma from Sorin Medical. How many times on Breakfast with the Beatles on Q104.3 have you heard me talk about Sorin Medical, about the heart scan, about what he's doing, which is incredible? Dr. Joe Puma, welcome back to Q.
Ken, great to be here with you again. Thanks for inviting me.
I can tell you all about this, but maybe you'll trust it more from a listener. I just got this from a listener. It's Beetle Bob. Ken, just got home from the procedure. Wow, you weren't kidding in your description of how it goes. Dr. Puma was so personal in explaining how clear my arteries are. He's a gem. Said he's going to see you later today. That's today. This was the best money I ever spent for the peace of mind it gave me. Thanks again, Bob. Not only that, he has saved lives of, I'm not going to mention who, but the partner of one of our DJs, and found out it is so important, heart health and everything else. Thanks for being here with us today, and thanks for being part of the Q1043 family.
Thanks for having me. You know, I love you. I love Breakfast with the Beatles, and what you do every day with kindness and compassion and caring, even in chaotic times, I'm trying to do on the healthcare side.
It's exactly true, and it's not about how much money you can make. You take insurance. That's the biggest thing.
Of course, we accept insurance. If people's insurance doesn't cover it, we take care of them anyway at no charge. I've said it before and on multiple platforms. I think the key is understanding we have such incredible technology in this world now that can diagnose heart disease before something terrible happens, and it's inexpensive. And we're just trying to educate people and raise awareness.
You've got the latest equipment. Talk about this heart scan.
So we have the most advanced CT scan in the world. It's the fastest CT scan. As you know, we've discussed, imaging anywhere in the body doesn't move except the heart. So you can't have just a regular CT scan. But what we do is our process in terms of how we get the heart rate slowed down, optimize the arteries before we take the pictures, and then the AI software that we use on every patient. So we're able in 3 minutes to see the anatomy, the actual angiogram of the arteries in a non-invasive test. Inside the arteries, if we're driving a car through the arteries, to see plaque and to determine whether it's high risk or low risk plaque. And then third, if there is any blockage or obstruction, the AI software objectively tells us if it's severe and needs to be treated with a stent or bypass surgery, or not severe and just needs medical therapy.
And by the way, I had this done. You know what I felt while they were doing this for 3 minutes? Nothing. Nothing. Pain? No pain. Nothing. Could save your life. It won't hurt. And they take insurance. What else? They give you lollipops. What else can I tell you? One of the things that I see is so many people, gentlemen especially, but women as well, certainly of a certain age, we have this trope. We go, getting old, I don't move like I used to. You see people getting out of the chair, and there's arthritis and there's things, and we attribute it to old age. But the point is, when you look at our rock stars, Paul McCartney, Ringo, 50th anniversary tours, George Thorogood, Blue Oyster Cult, all of our friends, nobody's stopping. We're going and going. There's no, people ask me, when do you want to retire? Retire. When I draw my last breath, we're going, we work. So a lot of what we assume is old age is actually heart disease, other body disease that can be treated.
Well, it's the aging process, right? The body clearly changes, and there's really one key idea, I guess. The more mobile you are, usually the longer you live. The less mobile you are, the less long that you live. And I've been practicing 40 years. You see this, we see this all the time. Now, what are the things that make us immobile as we get older? Well, heart disease, right? Shortness of breath, chest discomfort, fatigue. That's number one. And then orthopedic issues, arthritis. Knees hurt, your joints ache, your shoulders hurt. And this is what makes people less mobile as time goes on. from my perspective, it's just identifying what the issues are and then determining the treatment options that we have. At Sorin Medical, we've innovated across all of these diseases.
So it's not just heart disease that you do.
Absolutely, absolutely not. We do focus, my passion is underserved communities. And by the way, underserved communities aren't just racial, right? Underserved communities are women. There are huge gender differences. The number one cause of death of women in the United States?
Heart attack?
Heart attacks,
Lost a dear friend to that.
right?
Thought it was indigestion.
And their symptoms are often atypical, not like what we see in the movies, the kind of squeezing chest discomfort or shortness of breath. They might be very atypical symptoms: fatigue, tiredness, indigestion, as you say. So we're just trying to raise awareness. We've been able to come up with a very accurate, very fast, and very inexpensive way to identify these things.
Fantastic. Arthritis too?
Arthritis, what's the probably the biggest cause of immobility in a over 55 population is arthritis, knee or hip arthritis,
Joint
right?
pain, yep.
What's one of the most common surgical procedures in the U.S. today? Joint replacements,
Right.
right? We live in New York City. We have hospitals dedicated just to joint
Right.
replacements, but some people get beyond the point of being able to have a joint replacement. Some people just don't want to go through joint replacement. The recovery is difficult. And so there are minimally invasive 30-minute treatments that we can do in our office to take away the pain from arthritis and make people walk out more mobile. People who couldn't lift their shoulder are waving their hand over their head before they leave the office. So there's lots of innovative ways, more than one way to skin a cat.
And the thing about it's not just living longer, it's about living our best lives. And if you can't reach the top cupboard to get something, you feel it's not embarrassment. You feel helpless. You need the grabber. You need the thing to try to get it. And that works. But if you could do 30 minutes, if you go to Sorin Medical and with a short treatment, you'll be able to do this. That's why we live in this crazy age of all the negative things that AI and what this modern world could bring to us. Oh, everybody, the kids on their phones. The upside is what they have at Sorin Medical. It's what science is able to do.
Yeah, the AI that we use, AI in medicine, at least in some applications, has revolutionized our ability to diagnose and treat certain diseases. But then at the same time, we learn to innovate as well and to do things less invasive, right? Nobody wants to go into hospitals anymore.
Right.
People want to, people hearken back to kind of the way it used to be, the old Marcus Welby days of medicine. You got to be a certain age to remember that, but that's actually what I think people want, and that's what we try and deliver throughout all of our offices. And by the way, it's okay if people don't come to us, but I want them at least to be educated and have an avenue, access to learning, so they could go to our website and learn about these different procedures, our Instagram page, and really find out what's available to them.
And it's all Sorin Medical, SORIN, right?
SORIN medicalny.com.
And you can find out where the offices are, satellite offices, make appointments. Please do this for yourself. And if you feel fine, like I do, I feel fine. So I went for Sorin Medical. I got the 3-minute heart scan and found out I have mild to moderate heart valve leakage. And I was kind of freaked out. And Dr. Puma said, it's going to be managed. Your blood pressure is fine. We're going to lower it a little bit, and we'll keep an eye on it. And it's a relief to know that it's, to find out early, like everything else that you have. The earlier you treat something, whether it's, carcinomas, whether it's anything, a polyp, in your colon, finding it early is the key to not making it a bigger problem.
Absolutely. And fear cuts both ways, right?
Right.
Some people fear going to the doctor. They don't want to find out. And then some people fear not going, that they get anxiety and stress about it. So fear can cut both ways. But we just hope people are proactive in their health.
And, the thing is, when we grew up, if you were tired or heart disease or you were told that, back in the 60s, you were told, don't get excited, don't get up too fast, don't run. just take it easy, and because excitement, could trigger a heart attack. Well, what about the flip side of that, where we are now, of do exercise, keep moving, but the procedures, I mean, even having a stent put in, so many friends have had it done, and if you're terrified by it, there's very little discomfort from having it done, correct?
That's correct. We put an intravenous in the wrist. You get sedation beforehand. It's your ambulatory. The procedure takes 30, 45 minutes, and then you're up walking 2 hours later. Now, and actually, one big development since I was here last, the Department of Health in New York State now has approved angioplasty or stents in ambulatory surgical centers. So the final rules are being written, but hopefully by the end of this year, you won't even need to go to a hospital for many of these procedures. You can have them done right in an ambulatory surgical center like we have in Lower Manhattan.
It's absolutely fantastic. One other thing to mention, and I didn't even know this, Dr. P, brain scans?
Well, we have the fastest, most advanced CT scan in the world, so we're able to scan the entire body. For some patients that need it, some patients that want it, and a full body scan. We again accept insurance for that, and what's the reason most people, when they eventually decide to advocate and go to the doctor, why do they do it? Because a friend or a neighbor or a family member, something happened to them. And, I had a patient recently, his brother unfortunately got diagnosed with pancreatic cancer. And
Sorry.
yeah, and it's terrible,
Yeah.
right? But now, he was healthy and doing great, but he's anxious. People are people, right? Fear cuts both ways. And so we try and accept everyone as they are.
Yeah, listen, growing up in Brooklyn, fair skin, but you're Brooklynite? Yes,
Yeah.
right? We grew up in the 60s, suntan lotion sometimes, oil, sometimes using the reflector because you had a date. As my dermatologist said, you weren't one of those lunatics who used metal to reflect. Okay, moving on. What the hell was wrong with you people? Because she's a younger woman. Like, I can't explain it. It's just how
The
it
baby
was.
oil and the
Baby oil
reflectors,
and the
remember
reflector.
that? Yeah.
So all this skin damage that I have, and as she explained to me, listen, you should skin cancer caught very early for 6 months or so, 98% recovery rate. Caught in 18 months, 70%. Caught in 5 years, 40%. So just do the math. I can't force you to come in, but do the math. You've already had a lot of damage as a young person. Just keep coming to see me, and we'll just keep freezing things and keeping an eye. It just makes sense, doesn't it? Doesn't it? Thank you. I'm talking to you. Yes. As you listen to Breakfast of the Beatles, you're watching this, and you're saying, well, I feel okay. You feel okay, but you know what hurts. You know you don't have the energy you have when you're getting out of the chair and it's this. Sorin Medical, why wouldn't you find out where you really are and if it could be fixed without any pain? That's the whole point. And I know it takes a while. It takes a while to nudge people to come and even to take care of yourselves. But you're right. When a friend or a relative has a heart attack or has a problem, that's when your spouse or your friend says, you should get checked. And I understand sometimes it takes that for a wake-up call. But this is when that wake-up call comes, and hopefully you can find it for yourself. Sorin Medical is one hell of a place to start, believe me. And not only that, the fact that you love Q104.3 and Breakfast with the Beatles, and thank you so much for being a sponsor on Breakfast with the Beatles, sponsoring live Breakfast with the Beatles last year, and we have another one coming up in a few weeks, April 26th. We're doing it live to celebrate the Revolver album.
We're really looking forward to that. We had a great time last year. We had a great response to it. So many, just as you said, there was a line around the block. And bringing the Beatles to a new generation, I think if all of those songs from the Beatles were re-released for the first time today, they'd still all be hits.
Yeah, nothing sounds like the Beatles, and nothing ever will. People try to copy it. Can we talk a little Beatles for you?
Sure.
What was your first exposure to the Beatles? What do you remember?
I think the first thing I remember is being a young boy in Brooklyn and my mother singing "Let It Be" in the kitchen while she was cooking dinner, humming and sing. She used to love to sing, and I could still hear that in my head today, and it was just beautiful.
Sure. So many people have said those things. I just recently interviewed Daryl McDaniels from DMC, Run DMC, who's become my new BFF. And he's great and worships the Beatles. Said, what was it? He said, Yellow Submarine is my favorite. I said, for most children. He said, but I was adopted and I was in foster care and going to school in a rough neighborhood. And I never wanted to be a gang. I didn't have any hate in my heart or anger. And this song said, we're all in a yellow submarine, and all our friends are all aboard. And many more of them live next door. And I thought that would be a safe, happy place to live on that yellow submarine. And it was a safe place. And so many people have said that, and I feel like that too. The Beatles would never bully you. The Beatles would never beat you up. The Beatles always had open arms and said, come hang out with me. So many friends have said there was domestic violence at home, and I'd run to my room and turn up the Beatles because that made me safe.
Their songs are themes of love and kindness and caring, and actually just a normal human experience, right? They were just from regular families in Liverpool. Kind of. My dad was a butcher. My mom back in those days. You graduated high school. You were fortunate. And, she learned how to sew. So she was initially a seamstress. But those songs were the soundtrack of my young life. Here, There, and Everywhere was my wedding song.
Oh.
And, I've been married over 40 years. My beautiful wife, Terry, that was our wedding song. And whenever I hear it on the radio, it transports me back.
And the truth is, I get that same energy from you and the entire staff at Sorin Medical. I am not saying this because we're recording this or advertising. You walk in that door and you realize that every single person there is there to help and cares about you. And it's not a number on a chart. And I felt that right off the bat. And everyone I have sent there to see you has come back and said the same thing. The woman who won the 3-minute heart scan said, oh my God, I think he saved my life. She needed like 5 stents or something like that. And she wrote, Kenny, I think you saved my life. I said, no, you saved your life by making the decision to go to Sorin Medical. I'm glad we gave it away and you won it. But just because you don't win it, please do that for yourself. Give yourself that gift in the new year. It's spring. It's 2026. You can clean up. You can get a new fridge. You can make a new start and lose weight and whatever. Give yourself the gift of taking care of your health, and go to Sorin Medical. Once again,
SorinMedicalNY.com.
And see you at Breakfast with the Beatles.
Looking forward to it. See you in the cutting room. Thanks
Excellent.
again, Ken.
Thanks.